Joining us right now to talk more about it is North Dakota Senator John Hoeven. And Senator, it's good to see you. Thanks so much for joining us.
Good morning, Maria.
First question, is this going to affect the timeline of the other items on your agenda and on the administration's agenda, like health care reform as well as tax reform?
No, I don't think so. You're talking about as far as Comey being fired?
Yes.
No, I don't think it will.
Okay, so what is your reaction to the president firing Jim Comey?
Well, really, it was on the recommendation of Rod Rosenstein, but you know, it raises questions as far as the timing, and that's what because of the Russian investigation, and that's what the Senate Intelligence Committee is looking into. So we really won't have answers to some of those questions until we get that report back from the Senate Intelligence Committee.
But, Senator, it's Dagan McDowell. You hear, say, Mark Warner, who is the Democrat, the leading Democrat on the Senate Intelligence Committee, just to name one, calling for a special prosecutor. Do you advocate that? Will you push for that, to look into this alleged collusion between the Trump campaign and Russia?
Well, Senator Burr and Senator Mark Warner, on a bipartisan basis, are leading that investigation, which is being conducted by the Senate Intelligence Committee. I think we should see what the committee recommends and go from there.
Senator, let's talk a little bit about the current health care proposals. Representative Ryan kind of built them in isolation in the House of Representatives. How do you think those proposals are going to land on the Senate, and what do you think will emerge from the health care reform proposals? Well,
the Senate's going to write its own bill, and we're actively working on that right now, and it's challenging when you've got a caucus that ranges all the way from, say, Susan Collins on the left to somebody like Rand Paul or Ted Cruz on the right. But we have to get 51 votes, and if we can get that whole spectrum of our caucus on board on some kind of consensus, we should have a pretty good product for the American people.
Yeah, but I mean, we just saw what went on in the House and how it was a fight till the end in terms of getting a bill out. Was there nothing in the House bill that you can look at and keep in your bill? I mean, the idea of starting from scratch has some people scratching their heads because we just went through such a long process with the House. People want to see this bill get to the president's desk.
Right. There are ideas we can build on. The House bill is being scored. It's going to take about 2 weeks to get that score. But we have our own ideas as well. And remember, the goal is to have health insurance that is more affordable and access to health care and for everybody, for low income and more competition, more choice to help bring prices down. So that's the challenge, is to come up with a product that accomplishes that objective.
Yes. Go ahead, Kirsten.
Senator Kirsten Haglund here. What are you planning on doing about the Medicaid expansion and possibly bringing that back? Because we've heard that that's a big sticking point for the Senate. That's a large chunk of change that they're going to need to possibly pay for tax reform. But you have vulnerable senators going back to their constituents. You can't say we're taking away your Medicaid. How are you balancing that, and what are your thoughts about Medicaid?
Great question. That's right. We need to make sure that Medicaid, combined with a more robust, advanceable refundable tax credit, ensures that low-income people have access to affordable health insurance and health care. So we've got to bring those two together in a way that works, not only in terms of making that health insurance and health care available, but works for the health care providers and for the states. So I'm putting forward, for example, an idea for states that would choose that per capita payment approach, that in a year where they don't use their full allocation, they can bank some of that, so if they come up short in another year, they've got some reserve to work off of. Those are the kind of ideas that I think can help address that challenge. You're right, that's important. We need to make those kind of things work.
By the way, I know that the House really did overturn the Obamacare taxes. Are you going to put some of those taxes back in?
Well, what we're trying to do is to transition from Obamacare to health care that works and phase out taxes. So we'll work through that. Work in progress.
Yeah, but the word is that you want revenue. So you're going to probably have a tax in there?
In some of the proposals, the taxes, some go right away, some don't. But that, again, that's a work in progress. We don't have that final.
All right, Senator, we'll be watching for your final. And by the way, before you go, do you think it was the right move for President Trump to fire Jim Comey?
Well, I think, again, he did it on the recommendation of the Deputy
Yeah, but do you think it was the
Attorney
right
General.
move?
You know, I want to see that report from the Senate Intelligence Committee in order to answer that question.
Senator, good to have you on the program this morning. Thanks so much.
You bet. Thanks.
John Hoeven joining us there.